Hi, my name is Kayla, and I did whooping cough is my respiratory infectious disease. Signs and symptoms. Some common signs of whooping cough are a runny nose, red and watery eyes, vomiting, a red or blue face, and a cough that progresses into a high-pitched whoop sound when breathing out. Common symptoms of whooping cough are nasal congestion, a fever, and extreme fatigue. Some signs and symptoms occur as the infection starts to progress. The infectious disease has 3 stages. In the first stage, which lasts 1 to 2 weeks, the infected would have the signs as a runny nose and cough. In the second stage, which lasts 1 to 10 weeks, you would have signs such as the whooping sound cough and vomiting. In the third stage, about 2 to 3 weeks, is when one would have symptoms such as coughing lesions and the cough may return. Virulence factors and the pathogenesis. Pertussis is caused by a bacterium called Bordetella pertussis, and what makes them super contagious is that they attach themselves to the cilia in the part of the upper respiratory tract, in which then they release toxins and cause the cilia to swell, which then of course causes your airways to be inflamed due to the bacterium populating and then causing the lungs to be narrowed. B. pertussis does not allow the natural defense system to properly remove germs, which leads to infection. The mode of transmission is with air droplets from person to person with either coughing or sneezing. The bacteria only colonize the ciliated cells on the mucosa of the respiratory tract, but they multiply very fast and rapidly. This infectious disease is more prevalent within newborn babies and infants because of their weakened immune system and small airways. Exposure is mainly person-to-person exposure, and there are 3 stages to this infectious disease: catarrhal, paroxysmal, and convalescent. Catarrhal usually lasts 7 to 10 days, and the manifestations with that is a low fever and mild cough. As it progresses, they enter the paroxysmal stage, which can last from 1 to 10 weeks, and the manifestations with that include rapid and thick mucus coughs within the lung, with the long whoop cough at the end. Often with the paroxysmal stage, they have attacks at night, which have an average rate of 15 a night. After the paroxysmal stage comes the convalescent stage that lasts 7 to 10 days, and that's when you start to recover at a slow rate, and slowly the paroxysmal cough starts to die down and go away within a couple of weeks, but it does have the chance to come back. The epidemiology: more than 200,000 children used to get whooping cough a year. Now, thanks to vaccines, the highest peak year for whooping cough was said to be about 48,000 cases in the year of 2012. They said about 10,000 to 40,000 cases are reported each year within the United States. It is most prevalent within daycares and schools. About 83% of these instances have accounted for infants. Diagnosing and treatment. In order to get properly diagnosed, you have to go through a series of clinical tests based on the person's signs and symptoms. Some of the testings that they go through are serologic testings, polymerase chain reaction testing, and a culture test. The 2 main tests that they use are the culture test and the polymerase chain reaction. During the culture test, the doctor uses correct PPE and swabs the back of the patient's nasopharynx with a polyester Dacron tip swab. If present, then it will multiply and grow within a week back in the lab. However, this can only be effective within the first couple of weeks if detected early enough. So they use it within the combination of the PCR diagnosis, which can test solely for the pertussin DNA on the same swab that was taken from the already cultured bacterium. This test can be possible within up to 4 weeks of infection. The serology test is still being more developed to be as effective. There are 2 vaccines that protect against whooping cough: the DTaP vaccine that protects infants and young children, and the Tdap vaccine that protects teens and adults. A series of vaccines are given from the age of 2 months to 6 years. Other than that, the easiest ways to prevent your children and yourself from whooping cough is to get vaccinated and have your child vaccinated, as well as washing your hands and using proper hygiene.